When EFNEP first started, it was focused primarily on working with individuals in the home.
We live in upstate New York in a rural county. What it means is that we reach out to people that are sort of isolated, not a lot of public transportation, much of an agricultural community, not a lot of jobs, that kind of thing. So we're reaching out to young families throughout the county. We do more home visits just because of the nature of where people are at and they don't have transportation. So by us going out to those homes, we can reach them where they're at. It's hard. We love to get groups and we want to work with more, but we find that a majority of our work is done on a one-on-one basis.
In New York City, which is where I had most of my experience, all of my experience, the EFNEP program operates primarily in groups. And that was a change that occurred somewhere in the early mid-70s. Because extension was not recognized in New York City, there was very small presence of both Cornell and cooperative extension. We had to reach out to other agencies. And I think that's the biggest change that we made in the 70s, is to collaborate with other agencies. And as a result of that collaboration, it enabled us to do more group work. So we collaborated with daycare centers, with Head Start, with clinics. We would go to clinics, and we would do workshops in clinics. We would work anywhere there was a group, we would go.
I think one of the benefits that I've noticed over the years is we do seem to have more local community collaborations with other agencies, which is better than when we started, when we were just knocking on doors and really beating the pavement. I mean, that piece of it is, there's a lot of beauty to that.
Well, everything we do in cooperative extension is through partnerships. There's almost very little that we can do by ourselves because our work is so much associated with delivering education to communities. And to reach the community, we have to partner with many of the agencies, organizations, or systems that are already in the community. So we do that by connecting with them through schools, Head Start programs, daycare centers, after-school programs, senior centers. We connect directly with them, and we offer our services to them for the people who they serve. And then also we do it on a statewide level, and also we are partners on a national level with a number of different kinds of organized, formal partnership groups. And that is the primary way that we work, through partners.
The collaborations with agencies are critical. Working with our community partners, resources are limited. We all have to extend what each other has. And so when we can help another agency with referrals or whatever, and vice versa, we can help train their staff, they help train ours.
This is what collaborative efforts do. When 2-3 people put their heads together, something great can happen. And I really think that that's why this is important, for us to continue to work together, for us to continue to collaborate and partner in programs and services that are going to be, in the long run, benefiting our communities.